have PCOS, are you struggling to manage and control this disease? I know what your doctor told you. Here are your options. 3 medications. Let me guess. Number 1 is metformin because it controls blood sugar and insulin. Number 2 is spironolactone because it shuts the androgens down. And then number 3 is the birth control to shut your entire cycle down. I was given that advice too. And we all know that's a nice Band-Aid, but none of it solves the core issues of PCOS, or the PCOS Triangle, as I call it. PCOS, with all its peskiness, the oily hair, the scalp hair loss, acne, joint pain, weight gain, irregular periods, and so much more, is really the result of 3 main issues. It's the condition of your gut and your liver health, your overall hormone balance, and your toxic load, or the amount of chemicals you're being exposed to. To really solve PCOS, you have to tackle all 3 points of this triangle. Let's deal with the first one, your digestive health or gut health. I hope you're not rolling your eyes and you're tired of me talking about the gut, but it's still ground zero of your health, as I talk about in my book, The 21-Day Belly Fix. Your hormones are connected to your digestive health. And when it comes to PCOS, this is even more evident. The gut is a factory with all kinds of stuff happening there that need to stay in balance. There's your gut lining, your gut bacteria, and then all the helpers along the way, which include digestive enzymes, acid, and more. When this balance is disrupted, then welcome to conditions like reflux, bloating, constipation, and IBS, which I can translate now to leaky gut and poor digestion. In PCOS, I often see 2 repetitive patterns when it comes to gut health. I see a lot of gluten intolerance, and I see overgrowth of candida, or a yeast that lives in the gut. Here's how it works and what we've seen in practice. Gluten will disrupt the gut and gradually affect your hormones. It's not instant. So many patients have a gluten intolerance and PCOS, and I'm one of them. Simply eliminating gluten over time improves the hormone levels associated with the signs and symptoms of PCOS. The second gut pattern is an overgrowth of yeast, or candida. Again, that lives in our bellies normally, but it overgrows for a number of reasons. Too much sugar, too much dairy or alcohol, they can all trigger candida overgrowth. There are genetics too that predispose us and are predictive for candida and can make you tip over faster into that world than maybe your neighbor. Here's a quick trick. Take a look at your tongue. Do you have a thick white coat on the surface of your tongue? Well, that's one of the first signs that you might have candida overgrowth and your digestive health is not where it needs to be, both of which affect PCOS. Let's explain it a little bit. That might be hard to follow. So candida overgrowth, remember the yeast in our gut, it will spike insulin levels. Insulin is the blood sugar hormones, and that in turn spikes androgens. Androgens are the root cause of PCOS and are responsible for some of the common signs and symptoms. These include acne, oily hair, irregular periods, hair loss, and then weight gain. If you have PCOS, try going gluten-free and eliminating sugar as your first step, and then move on to getting rid of dairy and alcohol for about a 6 to 8 week period of time. It truly does take about that long to see a difference. Over time, both your hormones and your waist will thank you. The second issue associated with PCOS is hormone balance. I always say to my patients that PCOS is on a spectrum, meaning everyone's PCOS presentation is their own. This is evident when it comes to the hormone balance as well. I feel like every patient has their own unique hormone profile or blueprint. I want you to know the key hormone patterns. Be thinking through if any of these might possibly apply to you. Androgen elevation. The high androgens, testosterone, DHEAS, AMH, and 17-hydroxyprogesterone are common amongst my PCOS patients and responsible for many of the symptoms. Make sure to have those numbers tracked and checked consistently every 4 to 6 months so that you know your numbers and your trends. Estrogen dominance. We all need estrogen. It keeps our skin and hair youthful, our bones healthy, and our brain sharp. But too much estrogen and we're the opposite. We're mopey and dopey and we're struggling with weight. Here's how all of this plays together. Excess estrogen converts into the androgens, and now you already know why that's a big deal. So the best way to track this trend is to check estrone and estradiol levels and then keep them both under 150. Low progesterone. Progesterone, again, is responsible for the health of our cycle, our menstrual cycle, but also for keeping us kind of calm and balanced. Low progesterone is a common PCOS pattern and part of the story of estrogen dominance. Progesterone can be tricky to replace. It acts like an androgen in some cases. So progesterone replacement is not always the answer, but it's important to track it so that you know what your level is and what's normal for you. Many PCOS patients have thyroid imbalances, either a really sluggish or hypothyroid or sometimes hyperthyroidism as well. Thyroid hormone affects insulin, which is the weight hormone. In practice, the majority of my patients, again, it's unique to you, but the majority of my patients aim to have that TSH between 1 and 2. Last, but certainly not least, insulin is often elevated in PCOS. Check your fasting insulin levels, and this can help you know your number and make sure you're not eating certain foods that spike your insulin levels. So yes, I'm going back to the gut. And this is really interesting, by the way, because sometimes it's healthy foods that can spike your insulin levels and you wouldn't even know it. You know, I've had patients where sweet potato spikes their insulin or broccoli is not for them. So it's very individualized and personalized to you. Now let's get to the real reason why PCOS is the new epidemic. It's toxicity in our environment. The load of environmental toxins today is altering hormone levels in all of us, men and women, quite honestly. Patients with PCOS often have issues removing toxins from their body. Patients with PCOS often have delayed toxicity due to a gene called MTHFR, so they're even more susceptible to the load of toxins hitting us today. What are you supposed to do? Live in a bubble? Well, that's not realistic. Instead, work to kind of lower your overall toxic load by choosing to focus maybe on 2 of the 5 categories below. The first is food. The threat with food is pesticides. Think glyphosate and other organophosphates. This is a whole class of chemicals that disrupt the liver and then affect the hormones. So try to choose organic whenever you can. Another place where your toxic load might be impacted is your home. Household cleaners, off-gassing from floors and furniture increase our toxic load as well. This is our exposure to volatile organic compounds, which is another family of chemicals. Open up those windows and look for organic household cleaners and home materials to lower your toxic load at home. Body care, all our shampoos and soaps and makeup. Here is our load of parabens and phthalates. Those are hormone disruptors, meaning they mess with your overall hormone balance. Choose parabens and phthalate-free products to lower the load of these toxins. Quality of our water. In our water, we are exposed to heavy metals and other toxins, including remnants of prescription drugs and runoff from manufacturing plants. Use the right filters to help lower the toxicity from your water. Air quality, I'm seeing this one more and more. Mold is becoming rampant with climate change and with the way we're constructing our homes today. So really make sure the ventilation in your home or your office space is on point and really filtering for mold and other toxins. You want to check for dampness and use HEPA filters to lower the mold count in your home. So you've got it. You've got the PCOS triangle and the reasons why PCOS is becoming an everyday diagnosis. I don't want you to lose hope. I've been in your boat, but I want you to understand this disease and understand where you are on the PCOS spectrum and that you can and you will be healthy, vibrant, and amazing. I know this. This has been a personal battle for me and one, honestly, for all the women in our family for generations. Now that you know the core causes of PCOS, we've created a playlist to help you identify the symptoms. I'll see you on the next video. Do you have a PCOS story? Share and comment below.